Hi doctors, welcome to the Focus 30 Day 7. Yesterday not happened due to some emergency. One of my junior, he passed away due to some reasons. So today, I am come up with very important topic. Okay, you can see Delulu here. Delulu. Many of you people are fan of Delulu. I don't know Delulu. Delulu, that song also trend. So Delulu means delusions. So today I'm discussing about delusions, psychiatry, important syndromes, and main thing is our glycogen storage disorders. You can see here von Girgi. They will ask multiple times this only von Girgis, and you can see mission Indradhanush related to vaccination, vaccine while monitoring, and heat sensitive vaccine open vial policy, very important. Definitely one question will come. And eating disorders nowadays trending question. One question may come, most probably it will come from eating disorders or sleep disorders that I'll discuss in the next session. And opening is the diaphragms and like that. So we will go with the glycogen storage disorder first. Okay, so glycogen storage disorders, definitely one or two question will come. 2024 NEET, two question came from this area. And glycogen storage disorders, lysosomal storage diseases, these are very important. So I will be discussing about lysosomal storage diseases and familial hypercholesterolemia and everything in the upcoming days. And in next coming Saturday, Sunday, I'll be adding two modules in a single day, so that we will cover everything before 25th, and we will keep a revision session of complete. For example, I'll keep all PPT within 1 hour, 2 hours. I'll be telling everything in a fast, maybe in a live session or a video session. It is very important. You have to revise it. Okay, clear? Okay. So now we'll start with glycogen storage disorders, GST. So before that, we should know what is glycogen and how the importance of glycogen. So we know glucose, which is our energy molecule. Okay, so glucose, which is our energy molecule, which is converted into glycogen. Okay, so excess glucose, whatever glucose we have, it is converted into glycogen. Glycogen is stored in different parts, especially in the liver. Okay, so glycogen is stored in the liver. So what happens when you are fasting, when you are lacking some energy, you are not intake any, you didn't intake any food, you didn't eat food, you are fasting, that time our body needs glucose. So from that time, from glycogen, glucose is synthesized. So we know glucose is a simple molecule, but glycogen, which is a complex molecule. Now we'll see how it happened. See, this is the cycle. Now you can see, from glycogen I am taking you back. Okay, so glycogen I am taking you back. You can see the glycogen. See, glycogen have a linear polymer, some branches are there. So it's a branched carbohydrate complex. Okay, so this glycogen is synthesized from the glucose. Glucose is converted to glucose 6-phosphate. This glucose 6-phosphate, glucose 1-phosphate, and you can see glycogen. So there is a different pathway, glycogen synthesis. Okay, glycogen by the enzyme glycogen synthase. And you can see here why UDP glucose is added and how it is forming. So what happened, this glucose will become converted into glucose 6-phosphate, then it is isomerized to glucose 1-phosphate. This glucose 1-phosphate, this UDP glucose phosphorylase enzyme add this UDP glucose and make him a linear polymer. And there is something called a branching enzyme which add at 1,6 branch position may they will add again and they'll make a branched polymer, and glycogen become a branched polymer. This is the basic. So whenever you want a glucose from a glycogen, what happened, this glycogen, with the help of glycogen phosphorylase, it come back to glucose 1-phosphate. This glucose 1 come back to glucose 6-phosphate. Okay, and actually there are some branches still remaining. They have to cut the branches and make the simple glucose. Then for that we have something called debranching enzyme, or this debranching enzyme is there, and glucose 6-phosphate is formed, from there glucose is formed. So this is the basics of glycogen metabolism, glycogen synthesis and glycogen breakdown. So we know glycogen is a branched. Okay, glucose is very simple, we need glucose for energy, whatever. So this is the basic thing. Okay, very basic thing. From here only we will discuss everything. So now we are going to see the different diseases of glycogen storage. So glycogen storage disorders, where different enzymes have some defect and it cause some problem. pathology, that problem cause severe fatal problem or maybe mild problem, like that the categories are there. So can you guess who is this person? I had kept one person here, see, who is very smiling, and it written as New Zealand. He is a player known as Corey Anderson. Corey Anderson is a New Zealand player, and this recent World Cup he played for USA also. So he played for both New Zealand and USA. Is a special person. He played in Mumbai Indians. He played in IPL. Now he's currently playing in different leagues. So Corey Anderson, which is a New Zealand player. So think about Corey Anderson. So it will come in our discussion. Now we are going to see the different glycogen storage disorders. So I have divided into, see, glycogen storage types. We have type 1, type 2, type 3, type 4, and type 5, type 6, type 7, and type 0, etc. Few, etc. So this is the important one. Okay. Now here we want to know the names. We are going to learn 2 to 3 mnemonics or equation, so that you are going to solve all GST by solving that equation. Okay. Now, so before that, we will see individually what is the name. Type 1 is known as von Girgi, which is the most commonly asking doll like facies, whatever. So we will see that. Okay, that is type 1 von Girgi. Type 2, it is Pombis. Type 2 Pombis. Type 3 is Coris, and type 4 is Anderson. Type 4 is Anderson. So von Girgi, Pombis, Corey Anderson. 3 and 4. Corey Anderson, the age of Corey Anderson is 35 now. 35 now. So maybe few months back he was 34. Corey Anderson was 34 year few months back. Just imagine, he is still 34 year. Corey Anderson 3 and 4. He's a New Zealand player. Now played for USA also. Clear? Clear. Okay. Now we have 5. McAdles. 5 is known as McAdles. And 6 her. Okay. R 6, we'll discuss that. And 7 is Tories. Okay, so these names are very confusing, but we will study that also, and we are now going to apply some equations here. Okay, so the glycogen storage disorders, we have muscle glycogen storage disorders and liver glycogen storage. So I will tell you one equation. 2 plus 5 is equal to 7. 2 plus 5 is equal to 7. 2 plus 5 is equal to 7. So type 2 Pombis and type 5, which is McAdles, and type 7, which is Tories. 2 plus 5 is equal to 7. So Pombis, McAdles, and Tories, these are muscle glycogen storage disorders. So there is something associated with muscle. Clear? All others are hepatic. Liver glycogen storage disorders. So von Girgi, third Corey and Anderson, see, her. These all are liver glycogen storage disorders. Clear? Now we are going to see individual enzyme defects and problem. You know what happens? We had seen something called some enzymes here. Okay, before that we will see the disease and we will come back. So 2 plus 5 is equal to 7. Now what is von Girgi's? Von Girgi's, you can see the enzyme defect is glucose 6-phosphatase. Glucose 6-phosphatase. Imagine, glucose 6-phosphatase is very essential to convert glucose 6-phosphate to glucose. So imagine everything happen, glucose 6-phosphate is accumulated there. Okay, so imagine what happened. We are not getting glucose, but glucose 6-phosphate is accumulated. Okay, and we are not getting glucose. So we have something called hypoglycemia, and this glucose 6-phosphate is accumulated extra. You can see this glucose 6-phosphate is accumulated extra, and it is directed into the another pathways. You can see ribose pentose 5 pathway because of the side effect of that mechanism. So excess of glucose 6-phosphate is accumulated. It is diverted to another mechanism. So another mechanism is like ribose 5-phosphatase pathway. The side effect is hyperuricemia, increased uric acid can happen. So it can take into glycolysis where lactic acidemia can occur, and you can hyperlipidemia can occur. You can see it is converted to different. So because of excess glucose 6-phosphate, it causes hyperuricemia, hyperlipidemia, lactic acidemia, extra. Okay, this is very important because the excess glucose 6-phosphate is taken into different part. Okay, clear. Okay, so you can see glucose 6-phosphate become excess because of the deficiency of an enzyme glucose 6-phosphatase. Okay, so in von Wienergi what happens, this abnormal molecule will goes everywhere. It will cause problem like you can see hyperuricemia, hyperlipidemia, hypoglycemia, because why? Because glucose is not there, glucose 6-phosphate is there, no glucose, no energy, hypoglycemia, and lactic acidosis and ketosis because of the hyperlipidemia and all. And this causes a classical shape known as doll-like facies, thin extremities, and massive hepatomegaly. This is very, very important. Okay, now you can see the von Wienergi disease here. You can see it's a doll-like facies. Okay, hepatomegaly, distended abdomen. Okay, hypoglycemia, and that is also very important, and glycogen accumulation and kidney enlargement. So this is a classical feature of type 1 GST known as von Wienergi's disease. And why this is happening, I explain here. I'm not taking into detail. This much data or idea is enough to solve GST 1, that is von Wienergi. Okay, von Wienergi. Clear? Von Wienergi is clear. Simple. Now we come and see the mechanism here. See, glucose 6-phosphatase defect. So 6-phosphate, glucose 6-phosphate accumulated, divided into multiple metabolism. Lactate accumulation is there. Hypoglycemia because no glucose is there, and hyperuricemia because pentose pathway, and there is hyperlipidemia. It is diverted, and ketosis. So this is there because of the glycogen is excess and it is going to different area, and fan doll-like facies is happening. Clear? This is important. Von Wienergi is very, very important, and it can come potential question. Majority people make it correct. But now the problem starts. Now type 2, 2 plus 5 is equal to 7. 2 is muscle. So type 2 is a muscle GST. Here the deficiency or the defect is with acid 1,4-glucosidase, alpha 1,4-glucosidase or acid maltase defect. So enzyme defect is alpha 1,4-glucosidase or acid maltase. So POM. So POM is what I can say, it pumps. Pumps. So POM pumps, and it is having some problem with heart. So this is a muscle. So heart muscles are involved here, and you can see classically hypertrophic cardiomyopathy, cardiomegaly. Okay, and floppy infant due to extreme hypotonia, and children die by 2 years because of cardiac failure. So the heart, POMBs. Second, POMBs, heart, pumping heart, cardiomegaly, cardiomyopathy, and cardiac failure. Very important. Clear? So this is very important. So this is a muscle GST because of alpha 1,4-glucosidase problem, acid maltase. Okay, so type 1, which is very important. Type 2 also very important. They can ask, how they can ask, see how to differentiate. Like von Wienergi is separate entity, POMBs is separate entity. Okay, now we are going to see the next. And Corey Anderson, he is 34 Corey Anderson. So now we are going to study Corey Anderson. So 3-4 Corey Anderson. So I will write like another equation, A B C D. So AB one part, CD another part. So why? AB means Anderson branching enzyme. So Anderson branching enzyme, and Corey's debranching enzyme. ABCD. Clear? Okay, clear. So Corey's debranching enzyme, Anderson branching enzyme defect. So you have to see something very important here. Okay, so I'll write here only. Okay, so what happens, here glycogen is a branched molecule, so you can see branching enzymes are there. If any problem in this branching enzyme, so that is Corey's. Okay, Corey's, any defect in branching enzyme, no, it is AB, Anderson for branching, and Corey's for debranching. So Anderson AB, any defect in branching enzyme, what happened, this Anderson, that is a glycogen making defect. What happened? A glycogen making defect. Here glycogen is making. by 1,6 linkage glycogen is forming. So what happened? Because of there is no proper 1,6 linkage, there is no proper branching. What happened? Instead of branching, long straight unbranched molecule is prepared, formed. It is resembling. So instead of the branching is not there, so if branching is there, it will form like this. Okay, it will form like this. Okay, but there is no branching. That is why it is forming like a linear polymer, and it's look like something called amylopectin. It's look like something called amylopectin. That's why this amylopectin become excess, synthesized more, and it cannot be converted into glycogen because of there is no branching enzyme. So this is known as amylopectinosis. Anderson, A for A, amylopectinosis A, amylopectinosis, Anderson, AB, branching enzyme defect. So this is a glycogen making defect. A long straight amylopectin is accumulated, it causing problem known as amylopectinosis. Okay, clear. So this amylopectin, which is a strong molecule, which is a toxin, it causes problem to the liver and it causes scarring of liver and cirrhosis. It is dangerous. Okay, it will see that. Okay, okay. Now you can come and see Anderson branching enzyme defect. Fourth, abnormal glycogen, amylopectinosis. You can see here. No lack. So liver failure, it is fatal and dies by 5 years and increased liver enzymes. So liver failure, because this is fatal, causes scarring and liver cirrhosis because of the abnormal linear amylopectin, which is a toxin which causing liver damage. Clear? But what is CORIS? CORIS is nothing but debranching enzyme defect. Okay, CORIS is nothing but debranching enzyme defect. Okay, so you can see, I'll erase here. So you see here, now CORIS is debranching enzyme defect. So CORIS. Okay, now what happened? Some glycogen glucose is forming. So what happened here? It's a breakdown failure. Glycogen to glucose, it's a breakdown failure. What happened? There is no debranching enzyme, so the branch will stay like this. Glucose, it is not branched, correct? So because of that, this breakdown failure, no debranching enzyme, there is something called dextrin, limited dextrin is forming. Limited dextrin is forming. So because of the debranching enzyme, this CORIS disease, CD, these molecules are known as limit dextrins. Limit dextrin, there is a limitation as dextrins. Okay, so limit dextrins, and this will accumulate known as limit dextrinosis. Okay, this is also not good for body. This is known as limit dextrinosis. You can see here, and here liver cirrhosis is there. Liver enzymes also elevated. But Anderson, where amylopectin, which are high, which is very fatal, very clear. So I am summarizing here. Von Girgi, type 1, doll-like phases, glucose 6-phosphatase, hypoglycemia because there is no glucose, and hyperuricemia, hyperlipidemia, lactic acid because diversion into different pathways, ketosis, massive hepatomegaly, doll-like phases. Clear? Pombis, pump, 2 plus 5 is equal to 7. 2 is muscle GST. Because of what? This muscle heart problem, cardiomegaly, cardiomyopathy, and cardiac failure. Child dies at early ages like 2 years. Clear? Corey Anderson, CD. Corey Anderson is New Zealand player, 34 year, 3-4. Corey Anderson. And ABCD. A with B, C with D. A Anderson with branching, Corey's with D branching. So that is also important. And branching enzyme defect, linear polymer, amylopectin. Amylopectin causes amylopectinosis, liver, fatal problem to liver. So 4 and 3, which is debranching enzyme, where limit dextrins are formed. Limit dextrinosis, that is also problem to liver, increased liver enzymes and liver problems. Clear? These 4 are very important. In these 4 only majority of the question will come. Okay, clear. Now I am going to discuss next. So 2 plus 5 is equal to 7. 2 is discussed. 2 is what? Pombis. And 5 and 7, these also are muscle. These also are muscle glycogen disorders. So 5 is known as McArdles. Okay, so 5 is known as McArdles. Okay, so my muscle glycogen phosphorylase problem, you can see exercise intolerance and second wind phenomenon are seen. So what I thinking is hurdles. Hurdles, you know what is hurdles? There will be something like this, and people will run, jump and go, run, jump and go, run, jump, run, jump. That is an event in sports known as hurdles. So hurdles whoever doing are athletes. Okay, so athletes, they have good muscles. So any problem happen to these people, athletes, muscle, what happened? They have exercise intolerance. They are unable to jump. Correct, they are unable to jump. Okay, so usually if you jump, we will high five it. Yeah, high five sports. Really I like sports. I'm a sportsman also. High five to people. High five, which is Makadis, hurdles, sports, athlete, muscle. If you are any weak, cause exercise intolerance. Second win phenomena also can be seen. Okay, so just to think, McArdle's also muscle glycogen phosphorylase problem. So it is exercise intolerance will be the hurdles, sports, muscle intolerance, exercise intolerance. Clear. And 7 also is nothing but 7 also it's muscle. It is like, here there is a classical thing. That is why Tori T, and I'll write like 7. Okay, whatever, Tori T, which is I write like 7. Here what happened? Tori is like muscle and erythrocyte phosphocorticoid. So muscle GST plus erythrocytes, RBC is also involved here. That is why 7. You remember, like there is something called hemolytic anemia. Hemolytic anemia are seen with Tori's disorders, muscle glycogen storage disorders plus hemolytic anemia. It's a classical of Tori's disorders. Any signs of hemolytic anemia like LDH elevated, some peripheral smear may there is signs of hemolysis, and hemolysis, jaundice, whatever. So this is example of what Tori's, which is also muscle GST. 2 plus 5 is equal to 7. So exercise intolerance, hemolysis, and hemolytic anemia, muscle and erythrocyte phosphofructokinase. That is nothing but 7th one known as Tori's. And last one is our 6. By the time only we completed GST. Now we are going to see the 6. I will write R. Malayalam it is Aru. R is common in Tamil, Telugu. So 6 R. 6 R. Her. R, her. Everything. Her, everything. R. 6 is her. 6 is her. Her. He for He. He for hepatic glycogen. So this is also liver GST. That's why hepatic glycogen phosphorylase, He, and is no severe hypoglycemia. This is somewhat better. So R, her, R, and 6 is like R. 6th one, her, He, hepatic, her. That is clear. Symbol. Okay. Now we summarize glycogen storage disorders. This is very important. Definitely, one question is sure. If you are lucky, if you summarize this and understand this, you will get 2 questions also. This NEET may definitely 1 or 2 questions is sure from this topic. That is when I wrote NEET PG, it came 2 or 3 questions came from this area, and I got almost all wrong because I didn't study much. I studied, but I didn't revise. In my first video, I told biochemistry. I should have studied topics like glycogen storage disorder well. I should have get 2 to 3 questions. I should have taken good rank. But almost my rank came good, and I wanted which institute I wanted. I got, and I am taking a branch, and I'm happy with that. Okay. So this is a summary of glycogen storage disorders, which is very important. I had discussed. Watch it again if you want to better understanding. I didn't take in detail this data. This whatever I made the table. This is sufficient to score for NEET PG. We are not going to learn like medicine or in high level. Okay, we are just understanding the concept in the last 20-24 days of NEET PG. Okay. Now we are going to the another topic. Okay, this is also, see, this is the summary I already discussed. This is one key image. Come, please clear. So don't get trapped in the question. They will trap you in this area. Please read the clinchers, history clinchers, points, liver enzyme elevated, signs of RBC destruction, hemolysis. So things will change. Each word, each point is important. Examiner makes a question like that. If I am an examiner, I will trap you. Definitely, I know how to trap. I know how to filter students. So careful. Don't blindly punch or click on that answers. Okay. Don't lock. Okay. Careful. Now I am going to discuss something very very interesting and which is regularly coming in the exam, nothing but the eating disorders. The eating disorders, every one of us have some eating habits. Some people have, you can see a thin lady, but in the image she is looking like fat. See, people are mentally down looking like I am fat, actually they are not fat. Okay, so you can see here this image also same. See, she is good, looking good, but she is looking like fat in the mirror, so she is like mentally depressed. Okay, you can see some signs also here. Some people will eat so much and they'll feel like to purge it, they'll put finger on purge, so they have some wounds or lesions in the knuckles known as Russell sign. You can see this is classical. Whatever I put these images, this is very important for your exam. Now we'll discuss the eating disorders. We'll start with anorexia nervosa, bulimia nervosa, and the binge eating disorders. So these three are very important. Anorexia nervosa. Okay, anorexia nervosa. We can see anorexia nervosa. So it is usually seen in early adolescence. So what is this? Anorexia nervosa is intense fear of weight gain, distorted body image. Okay, and what happened? Less than 50% of the ideal body weight. Two types are there. So anorexia nervosa is nothing but it's a distorted body image with feeling of intense fear of weight gain. I got gained so much of weight, like that they feel and they'll express like that. So what happened? Their BMI will be very low. So actually their BMI is low and they feel like I am gaining. I may gain weight. I may gain weight. Weight gain will be there. I can't eat. So what they will do? There are two types: restrictive and binge purge. What? Some people highly restrict the food. They won't eat. They won't take the food. They won't take the protein. So what happens? They'll become BMI become low. They become weak. Huh? And binge purge, second variety. This is also very important. It is asked. There are two varieties: restrictive and binge purge. Binge type variety also is there in anorexia nervosa. People will eat, vomit, binge purge. Okay, so this is important here. BMI is low. Two types are there, and intense fear of weight gain. They are already in low BMI, and this is the problem with anorexia nervosa. Okay. So we will see the complications of anorexia nervosa now only. So they have medical complication. Definitely they are low BMI. They are not eating. Lanugo hair. It's like you can see the fetal hair type. There is no proteins, no proper supplements. Definitely they will become weak and their body will respond. And hyperprolactinemia, amenorrhea, changes will be there. And see here 10% risk for suicide. Those people are like, I may gain weight, I can't eat, and they'll become slim, they'll lose their mental thing and they will commit suicide also. Okay, and after that we'll start them with feed again, treating. So refeeding syndrome happens. So we have to feed cautiously, very careful. Okay. So refeeding syndrome is caused by increased calorie intake during the treatment. So it leads to some chemical abnormality like hypokalemia, hypomagnesemia, hypophosphatemia, like that. So these are the complications of anorexia nervosa. These are the lanugo. You can see the kids, babies ka these small hairs, lanugo hair. So this is very important. Their BMI is low actually. Their BMI is low. There are two types. This is also very important. After anorexia nervosa, we'll discuss bulimia nervosa. Nothing but binge eating and purging. No fear of eating food. There is no fear. They'll keep on eating and purging. Binge eating and purging. Binge eating and purging. Here their BMI is normal. Okay, their BMI is normal. Okay. So bulimia nervosa. Okay. So complication of bulimia nervosa. See, they are eating and purging. They are normal. But what happened? Continuous vomiting causes some problem in GI, and you can see mammary waist here where the mucosal layer of the junction of the esophagus and the stomach, there is tear known as mammary waist tear. This causes this is a lower esophageal tear. So mammary waist tear happen. So hematemesis may can come, and retching and Russell sign. What is Russell sign? They don't have any problem in eating. They will eat, they will vomit. So eat, they will put hand, knuckles are touch on the tongue or palate, and they have something called Russell sign. You can see here, this is Russell sign. Okay, very important. So that is there. Now binge eating disorder also very important. Yeah, seen in young adults. So most common most common eating disorder is known as binge eating disorder, binge eating beyond fullness. They will eat, they are full, but still they keep on eating, and eating in isolation. They'll sit alone and they will eat, and eating when not hungry. Whenever they are not hungry, they'll eat. Alone they will eat. Even though they are not hungry, even they full, they will eat. Keep on eating, and their BMI is very high. And after that, eating so much, watching the movie Netflix, eating, and they feel like guilty and feeling guilty, and then they are like eating rapidly. So these are the features of binge eating disorder nowadays in the generation. They are addicted, and they will be keep on sitting watching the movie and keep on eating. They are not going to any sports or activities. They are not involved in any what I can say, physical activities. This is very dangerous. Okay, so these are very important: anorexia nervosa, bulimia nervosa types, and binge eating disorder. In anorexia nervosa also, binge purge type is there, very classical. Okay, clear. Now we are going to something called very simple one, openings in diaphragms. Okay, you can see the diaphragm here. So this is the classical image. You can see the anatomical landmark here. You can see in the spine. This is the T8 thoracic vertebrae, T10 and T12. At three different area there are openings, and we can see few contents are going. Okay, so we can see the ideally it is written here, the main one. See, this is the main one, IVC. This is esophagus. This is aorta, whatever. So see here, openings in the diaphragm, very important topic. Okay, so we had made a classical mnemonic. This mnemonic is common for everyone. Somebody prepared, we are following that. So that is the example. I ate. 8 means I ate 10 eggs. I ate 10 eggs at 12. So this is the classical mnemonic. You can see here, I ate 10 eggs at 12. I ate in T8 में inferior vena cava, IVC, and along with right phrenic nerve is there. You can see the T8 में IVC. You can see the IVC here. Okay, IVC here. Clear. Now we are going to next 10. I ate 10 eggs. 10 T10 में eggs, EGG, esophagus, vagus nerve, and the esophageal branch of left gastric artery. So vagus ka G, left gastric artery ka G, and esophagus, EGG, egg at 12. So you can see AAT at 12. A for aorta, A for azygosome, T for thoracic duct at T12. Okay, clear. Simple. I'm not explaining in detail. I ate 10 eggs at 12. This is very important. Please see this by heart. I'm not going to explain it again because already time is crossing. Now I'm going to discuss something called delusions. Okay, delulu in the figure you had seen. Okay, 1 minute. Sorry for that. So delusion, I'm going to discuss about delusions. So delusions are nothing but false fixed beliefs. Okay, so ideas are false fluctuating beliefs. So this is very important. Okay, now we are going to discuss very important delusions and some syndrome which can directly come as the direct questions. Okay, now delusions, we have persecutory delusions, grandiose delusions, and referential delusions. Okay, these are some delusions. Now I am going to discuss something called some syndromes. You can see called Magnan syndrome. So Magnan syndrome, it is known as Magnan syndrome. It is known as cocaine psychosis or formication. You can see here. So there are some these are tactile hallucination. They'll feel like some bugs are going through their skin. They'll feel like some bugs are going through under their skin. So those who are injecting cocaine or taking cocaine, they feel this Magnan syndrome. This is a delusion of persecution plus tactile hallucination. This is a tactile hallucination. Cocaine bugs. Okay, very important. And in Greek, there is a classical character known as Othello syndrome. Delusion of infidelity. So you can see in the diagram only, the partner is talking to somebody in phone or chatting, and this guy is looking at her. So he is suspecting delusion of infidelity of a spouse or partner. So he's suspecting she is in relationship with other guy, or she is having some affairs with some other person, physical affairs, whatever. So this is known as Othello syndrome, which is a classical Greek character. Okay, okay, clear. Now we are going to see what is D. Clermont syndrome. Nothing but delusion of love, erotomania. Whoever you are seeing, you feel love, attracted. So erotomania or this D. Clermont syndrome, you are attracted to people, think that another person in love with them or her. So you are feeling he is loving you and you are going to love them. This is like delusion of love or erotomania. Okay, this is very important. And Cotard syndrome, nothing but it's a nihilistic delusion and it's a severe depression also. So Othello syndrome, which is very important. Othello syndrome, Magnan syndrome, and D. Clermont syndrome. Okay, like that. So cocaine hallucination, regularly they are asking cocaine bugs, Magnan syndrome, tactile hallucination, Othello syndrome, delusion of infidelity. This is also very important. And this erotomania or delusion of love, D. Clermont syndrome. This is also very important. Clear? Clear. Now we are going to discuss the other important syndromes, very important, delusions of misidentification. So misidentification. We have something called negative misidentification, positive. Imagine there are two members. One member is standing here, one member is standing here. This member is your known person, maybe a friend or wife. This person is some stranger. So you identified that this is a stranger. You identified this is a stranger. He is coming and attacking you. This stranger is wanted to kill you. He is coming and attacking you. So you identified he is a stranger. So you identified he is a stranger. That is positive. But here your wife is there or a friend is there. You didn't identify them. They are going to kill you. So you identified non-person as stranger and they are attacking you. This is negative identification in a simple way. Now you see negative, known as Capgras syndrome, delusion of doubles, misidentifying one's spouse as a stranger. Your wife, you are thinking like a stranger and she is coming and attack you. Okay. And Fregoli syndrome, misidentifying a stranger as one's persecutor. The stranger is going to kill you. Okay, symbol. So what is Capgras syndrome? Cap. Fights with closely associated people. Cap in known as closely associated people. So Capgras syndrome means it's a negative misidentification where the known person become unknown. You are not understanding he is the known person. You are thinking like he's a stranger. Clear? Positive identification means stranger is that you understood he is a stranger and he is coming to kill you. That is Fregoli syndrome. Goli is like gully. Fight with gully. Fight with strangers, gully people. So Capgras and this is important. You can see the Capgras syndrome here, Fregoli syndrome here. Capgras means what they are telling. The delusion in Capgras syndrome is the belief that a familiar person has been replaced by an imposter. Familiar person thinking become as a stranger. And Fregoli may different people or stranger are in fact a single person who changes his or her appearance or in its disguise. Means here this person which is a stranger is trying to attack him. Symbol. Okay, this is an unknown person, this is a known person. That's a positive and negative misidentification. Okay, clear. So we will stop this Capgras syndrome, Fregoli syndrome, these syndromes are here, and this Magnan syndrome, very important, Othello syndrome, and you can see D. Clermont syndrome. This is also very important. You have to know all this. Okay. Now we are coming to the last topic today, nothing but vaccines. Vaccines are highly important. One question is sure from this vaccine. That is sure. One question is sure from vaccine. You can see here, what is this? This is Mission Indradhanush. Mission Indradhanush. You can see this is Mission Indradhanush. So this is, see, you can see in different color rainbows. Okay. So national immunization schedule, 7 visit until 5 years of age. So 7 colors, 7 visit should be there until 5 years of age. So 7 colors PG or 7 visit till 5 years. So here some recent updates are there. Rotavirus vaccine brought under open vial policy. Rotavirus came under open vial policy. We will discuss that. Japanese encephalitis went to kill the vaccine. Okay. So these are the immunization schedule. You can see at birth, 6 week, 10, 14, 9, whatever. So you have to see this. You have to understand. I am not going to discuss this. Okay. This is the immunization schedule, and Mission Indradhanush, 7 color, 7 visit under 5 years of age, and rotavirus come into the open vial policy. JE killed the vaccine. So we will see that also. So vaccine, there is some upper limit also. Okay, so OPV 0 days, you can give up to within 15 days, and hepatitis B birth dose within 24 hours. So like that, there is an upper limit also. You can see DPT vaccine up to 7 years you can give. Japanese encephalite up to 15 years you can give. So these are the question they may ask you. Okay, so very important, DPT up to 7 years and JE up to 15 years. This also very important. Okay, clear. So now we are going to see very important. There are some side effects of vaccine also I had mentioned here. See, inconsolable cry associated with DPT. That's why whenever a baby is taking a vaccination at 6 week, okay, 6 week. So this DPT or pentavalent, which having a inconsolable cry, we are giving this injection in the last. The order of injection after giving drop injection, pentavalent is the last, because pentavalent cause severe cry. My baby had taken recently vaccination. They injected pentavalent and she was crying a lot. Okay, so that's why we have to give pentavalent in the last. Very important. Okay, I have a 3 month now. Baby is 4 month now. 4 month baby. That's why night and all I used to be little offline because of taking care of my baby also. Okay, now so there are some, see, rotavirus side effect is intussusception. This is very important. Rotavirus, they can ask this. Okay, and we are discussed in community medicine, very important is OPV can cause vaccine associated paralytic polio, VAPV. Okay, if we discuss it, we will go to detailed class. Just understand VAPV, vaccine associated polio, paralytic polio. This is very important. Okay, vaccine associated paralytic polio. Okay, so these are important. You can see measles, JE, whatever the side effect you can see here. And now we are going to see the one spotter. You can see this is nothing but ILR, ice lined refrigerator. This is very important. From here, question is going to come. Ice lined refrigerator, temperature 2 to 8 degrees Celsius. Coolest area is the lowermost area. The lowermost area is the coolest area. You can see the vaccines are there. Some vaccine name is written there. See, and vaccine placement, freeze sensitive vaccine kept at the top. Those, see, you can see in the ILR, ice lined refrigerator, the coolest area is the down bottom. So imagine a vaccine is freeze sensitive. Whenever it is exposure to more cold, it is sensitive and it damage. We have to keep it in the upper compartment. That is very important. Now we are going to see that. Okay, now we are going to see vaccine sensitivity order. Okay, freeze sensitive vaccine, hepatitis B. So that's why we have to keep hepatitis B in the upper, pentavalent, PCV, whatever. And vaccine sensitivity order, heat sensitive, OPV and measles are heat sensitive. That's why we have to keep it in the cold bottom. We have to keep this in the bottom. Very important. Clear. Now we will come back. Okay, now you can see here the heat sensitivity top to bottom order ILR. You can see in the top is hepatitis B. You can see here top is hepatitis B, down one is OPV. So OPV, BCG, you can see in the image here. See, OPVs, BCGs, these are in the lower part. Like it is like heat sensitivity. Let it be in the cold region. Okay. And you can see hepatitis B is cold sensitivity. It should be in the heat, relatively higher temperature. That's all. Very important. So we have something called live vaccine, killed vaccine. I had made the chart. Please watch this. And next, so that you have to read. Okay, just to see this. And next, I am going to discuss something called vaccine vial monitoring. In a vaccine, there is a vial. You can see here. This is also, you can see there is a square here. Whenever this square and this round color become match, see, it is coming a little faded, but still we can use. Now it is like completely singing, and here now it is changed. These two should be discarded. Very important. So these two we can use. These two we can use. These two should be discarded. This is very important. Please study this also. This will come as a simple question for you. Okay, clear. Now so now also you can see the vaccines, how they are kept under and in the ice lined refrigerator. You can see like that also. So I had discussed about that already. So vaccine sensitivity, hepatitis B will be in the top, and you can see OPV, BCG will be down, because here temperature will be high. Imagine 8 degrees Celsius. Here it will be 2 degrees Celsius, because the range is 2 to 8. So this is heat sensitive. Okay, so This is freeze sensitive, freeze, because if it is exposure to cold it will damage, if it is exposure to heat it will damage. This is simple. Okay, clear. Now there is something other topic called open vial policy, and I discussed about something in the starting. Here starting only we are discussed rotavirus vaccine bought under open vial policy also. Now we see here open vial policy. What is open vial policy? The vaccine can be kept in a health center for 28 days with proper temperature maintained. When once the vaccine is opened, it can be stored up to 28 days in a proper maintained temperature. Clear? So this is open vial policy. If the vaccine falls under the open vial policy, okay, so the VVM, we have to see the VVM also, color changes. The VVM will be located on the body of the vial. So whenever open vial policy is there for that vaccine, the VVM will be located on the body of the vial, in the body of the vial. So what are the vaccine open vial policy does not apply to? So majority of the vaccine it's apply. Open vial policy does not apply to: one, measles rubella MR and BCG and COVID-19. So Mr. BG got COVID. Mr. Bharat Gowda got COVID. I was thinking like that. My friend Bharat Gowda, we are calling him BG. So Mr. BG got COVID. So Mr. BG COVID is not open. Actually, is not an open person. So open by policy ko not apply to this one. So Mr. BG he got COVID. Mr. BG COVID, open while policy is not applied. Is not open. So like that I studied in my childhood. Mr. BG, instead of BG you put any background or whatever, some name. Mr. BG COVID, MRBG COVID. You can make any mnemonic also. This is very important. So open while policy which is not apply for measles, rubella, BCG and COVID. Very important. Okay, clear. So clear. So vaccine sensitivity order is very important. This they will trap you with question. Please understand these. And this open vial policy also they can ask. You have to know vaccine while monitoring images. You have to know live vaccine, killed vaccine, just to see this. And why this order is also very important. See Iceland refrigerator. So they will trap you here also. They can put here, you should know OPV should be the low and hepatitis B in the upper side, and you should know what are some upper limitations of DPT, JE, hepatitis B, and if you know OPV also, okay, like that. So these are very important. Okay, and some side effects of vaccines, especially vaccine associated paralytic polio, intussusception of rotavirus, and inconsolable cry of pentavalent. That's why you have to give pentavalent injection in the last. Okay, and mission Indradhanush 7 color, why importance, and vaccination schedule you should know. They won't ask in vaccination schedule, but you should know. Okay, and delusions, especially Capgras syndrome, Fagoli syndrome, they are asking. Othello syndrome, Magnan syndrome is regularly they are asking. Very important. Okay, and this opening in this diaphragm nowadays they are not asking that much, but you should know that also. And this is the nowadays regular question, because our generation going to this obesity and eating disorders. So eating disorders is also very important. And glycogen storage disorder, I don't know, please watch my video again, at least for the glycogen storage disorder. Make it a small note separately, make it your notes. Don't ask my written notes or highlighted notes. Make your notes. At least you also put effort, it will reflect in your exam. Okay, so today is Delelu day. It's a delusion day, and please watch this video. Any thing, if you want to study new, please stop it. Just study whatever you already covered. Revise it. 25 days are there. Only do the PYQ of 3 to 5 years. Revise the PYQ. See the PYT. If you are weak with any strong subject like medicine, surgery, if you are weak in that subject, don't put so much time in that. Go to the small subject like derma, radio, psychiatry, forensic. Study it multiple times. Do PYQ and go. You will get better rank than studying a big subject like medicine and not answering or not getting correct in that topic, that subject. Okay. So these are today's topic. Actually, I am also tired. I have a hectic schedule in this week, and I had some yesterday emergency unable to put. I was also literally emotion yesterday, and I was really unexpected that and all. So I went to little like feeling low actually that yesterday, and it was like very different feeling of someone who lost those who played together, those who talked so much unexpected news. So this will happen, and he was preparing for NEET PG, and he got some cardiac arrest, or I don't know, he tried for committing suicide or whatever. So we don't know the truth, and I didn't ask that also. So if you are in a state of depression or something and preparing NEET PG and this in sad phase, don't do blunders, or if you have any problem, talk to somebody, some mentors or some friends or some family, and get your attention. If it is medical attention or you need mental attention, whatever, please get it. Don't spoil your life. And always health is important. Not like a PG seat. Never a PG seat decide your life. Actually, PG seat, if you get your life, it will be more like that, but it's not the end of your life. If you didn't get medicine, you will be getting anesthesia, you are not satisfied, not nothing like that. When you get any branch, like whatever your rank, your capacity, take the branch, be excel in that, live a simple and good life. Life is single, we have to enjoy that. That's all. Okay, thank you so much for today. We'll be coming with some more topics tomorrow, day after tomorrow, in Saturdays, and I'll be putting more topics in small session. Today's session will be little lengthy, but please watch it. This is very important, and thank you so much.